Koutou. Welcome to our public health seminar for today. I think it's the last of our public ones for the year, so thanks for coming along. I'm Ruth Cunningham from the Department of Public Health, and I've got the pleasure of chairing today and introducing my good friend, Helen Lockett. So Helen is the Strategic Policy Advisor for the WISE Group, which is a group of community organisations working in the mental health and addiction sector. She also plays a leadership role in the Equally Well Collaborative, which is where I have a close relationship with her, working on the physical health of people with experiencing mental health and addictions challenges. And she has a strong interest in the relationship between mental health and work, which is what she's going to be talking to us about today. She led some work for the OECD, and she's going to be talking today about her PhD. And actually, I should also mention that she's now an Honorary Senior Research Fellow in the Department of Public Health here, and we're hoping to be able to do some research work together. But yes, I'd like to introduce Helen Lockett.
Thank you very much, Ruth. It's really lovely to be asked here, and it's even lovelier that you've come in to listen to me on a December lunchtime on a Friday. Just see if I can get this working. If not, I'll just use this. Tēnā tātou katoa no ingarangi o ko Helen toko ingoa, kia ora tātou katoa. Whilst I hail from England, I've been living in the Horomaka, down in the lovely Banks Peninsula for the last nearly 10 years. As Ruth has said, I have a strategic policy role with the WISE Group. This is my two mokopuna, not my children, my two mokopuna, Ruan and Jago, giving me a bit of a shout out, encouraging me. And I guess also they were a big inspiration for me to not only continue doing some of the work I do around system change, because we need some lasting change in this area, especially if one of them experiences a mental health or addiction issue in their lifetime. I really want it to change, but also that energy to finish a PhD process, which for those of you who've been involved in it is a long, lonely desert at times. So I wanted to get through it so I could spend some more time with them. They live here in Wellington. And as Ruth said, some of my passions and some of the things that you'll hear me talk about today are around achieving physical health equity, but also, most importantly and often really unspoken about, the enormous employment inequity experienced by people, particularly who are in contact with mental health and addiction services. Thank you also for those who've joined on the webinar. Can't see you, but you can see me, and thank you. I appreciate you coming and joining today. And you can post your questions, I believe, as we're going along. So let's go back to that title, improving the effectiveness of evidence-based practices. So try to keep it broader, but I'm going to talk to you about what I looked at in my PhD. But if you're not in this area of vocational rehabilitation in mental health and addiction, then you can hopefully apply some of the method that I've used in your own sphere, and I'm going to touch on that. And I'm really interested in having a longer dialogue with those people around that if you're interested. And also, as you know, with doing a PhD, there's lots of work that flows from it. So again, I'll put some shout out points where people might go, oh, I'm about to do a master's, or I'm going to do a PhD. I'd like to work with Helen. This is a bit of a promo, but you've worked on your own on a PhD, and the idea of being able to lead some work, there's a number of other questions and some exciting pieces of work that flow out of this. And one of the examiners actually got in touch from Canada and wants to work on this. So this is exciting, but there's lots of work in here, lots of research for people. So before I start, I just want to say a bit about the language I'm going to use as I talk through. So the group of people that I'm going to talk about this employment interventions is supporting is what might usually be termed in the medical profession as people with severe or enduring mental illness. Severe mental illness, and I won't be using that language when I present. I'll use the term people with lived experience or people experiencing mental health and addiction issues, but actually I'm referring to a group of the population who actually are experiencing significant challenges to getting back to work, may have ongoing symptoms and need ongoing support from the health teams around that. So I wanted to say a little bit about that. If you're interested more about language, I really recommend the adapted version of some work from the States that Caro Swanson did in there. There's a Real Language, Real Hope. I think a lot about the language in terms of the more we disseminate research, the more we need to think about the way in which we present that, because actually if our language isn't working, then no one will listen to the research regardless of how rigorous and great it is. So the other thing I'm going to talk about is use the term vocational rehabilitation, also employment support or supported employment, which might be more familiar to you. So I'm looking at a set of evidence-based practices supporting people back to work, or actually to stay at work. So that's what I mean by vocational rehabilitation, supporting functional recovery, not just symptom recovery. So the background to my research in this area is that we have in the vocational, psychiatric vocational rehabilitation field, we have over 3 decades defined and validated what we have now as a set of evidence-based practices in vocational rehabilitation. These practices collectively are known as the individual placement and support approach. Now, just a bit of a hands up here, who's heard of individual placement support, just so that I can know. So many of you haven't, right? So I'm not going to tell you about we're not going to tell you about individual placement and support. There are some other literature around that, but it's a known set of evidence-based practices underpinned by 8 principles, and there's a Fidelity scale by which we can welcome, come to the front, yeah. Well, I've got no interaction, so it'll be fine. I might be a bit of interaction, I just did one there. It's got 8 principles, and there is actually, we're really lucky in this psychosocial intervention because there's a Fidelity measure which has also been validated, and it's very reliable, that allows us to measure what we are delivering, so the process, so the recipe, if you like. So the Fidelity scale, we have those, and which means we can understand how much of an individual placement support, how much of this practice is being delivered in a particular area. Now that's unusual, that's great that we have that. Now, if you're delivering to the individual placement support practices, it's been proven worldwide now that that approach to supporting people back to work is at least 2 times, if not 3 times more effective than other approaches to supporting people back to work. So that might include something like a sheltered workshop, a training environment. It might include supporting people in clinical services, and then people going to something like the public employment service like we have, Work and Income. So if you use a program called individual placement support, then actually that's going to be 2 times more likely to get somebody into work than other types of employment support that we have. So that's just background you need to know. And I'm looking at actually the fact that even when we implement to what's called high fidelity, we get variation in program performance, and it's still not supporting everyone back to work. So I was interested in my PhD of saying, well, we've got this set of evidence-based practices, how can we make them better? So whilst my other day job with the other hat that Ruth was describing is to try and get those services available across New Zealand. Basic individual placement support in Waikato, Auckland counties, Northland, increasingly here in Wellington, Taranaki. We have some individual placement support programs, but not across the country. So just to make that clear, we don't have them available, but my research was looking at how, once we make them available and we get to them to good fidelity, how do we improve them even more? So those of you, you think about something like Housing First, which is another evidence-based practice. Anyone here working in Housing First? Yeah, so you are really interested in your thoughts as you think about the Housing First Fidelity scale and the kind of process I went through. I've just recognised you highly. Nigel. So that's the background. So some of you familiar with implementation science will talk about the fact that if you've got an effective intervention, so individual placement support, Housing First, cognitive behavioural therapy, if you've got an effective intervention, it's only if you effectively implement it that you're going to get the outcomes, especially in a real world setting and not in a randomized controlled trial, right? So we know this. Now, in the world in which I'm working is we have conceptualized implementation as adhering to fidelity, to the current model or the evidence-based practices. So that makes sense to me. If I've got the colleagues in the front who are implementing this, if you'd said to me 5 years ago when I started the PhD, how do I improve program performance? I'd have said, just improve your fidelity score. You can score up to 125 on IPS 25, just keep improving. And that's not what I'd say to you now, and we'll talk about that, but that's what I would have said. So the first study, and if we think about trying to improve program performance, we need to understand what contributes to the variance in program performance. And in this case, I was looking at, firstly, then let's look at the relationship between fidelity to individual placement and support, adherence to the current model, and program performance. So I conducted, and I must at this stage just stop and pause and say, I really also want to acknowledge Professors Jeff Waghorn and Robert Kidd for their support in terms of their supervision of me over the 5 years. And wonderful people. Getting your supervisors right is crucial, isn't it, in a PhD journey? And they were just amazing. And also David Chant there, you can see also on the first paper we published, who was the statistician that I worked with. Get a good statistician. Also really important, all of you know that. So yeah, really just want to acknowledge their work and their support and their involvement in this. So that was the first thing we looked at. How much does Fidelity account for the program performance in individual placement support programs? I was a very diligent student with my systematic review, so I had a very clear inclusion criteria. Basically, I was looking at studies of implementing individual placement support programs all across the world that have been published, had measured their fidelity to IPS. Now, it's amazing, isn't it? Many people, when I looked at some studies, they hadn't actually measured the quality. They definitely had of the intervention, but often not necessarily of the control. It's a bit like doing a drug trial and not actually checking that you're delivering the right recipe of the drug that you're giving. That's how best I can explain it. If we're not measuring fidelity, we're not measuring the quality of what we're giving people in the trial. But I was able to find an enormous amount of literature, but there were some gaps in that. And I really encourage any researchers implementing individual placement support or housing first is to clearly and independently measure the fidelity of the intervention. So looked at those studies, there's two scales, IPS 15 and IPS 25. I wasn't able to find enough published studies using IPS 25. You could now. Anyone plug? Anyone like to repeat this for IPS 25? Be great to do that. So here you can see I started off with a large mass of articles and was able to get it down to finding 30 articles that met the essential inclusion criteria, and then look at 69 individual cohorts that were following a group of people who are unemployed, who had a diagnosis of a mental health or addiction issue and were being supported back to work. So 69 independent cohorts across the world. In that group of people, just over 8,000 participants. So some were IPS 15 and some were IPS 25. This will make a bit more sense when I show you the findings. But a large sample for us to be able to do some statistical multivariate analysis with the data that we managed to obtain for the meta-analysis. So let's have a look at the relationship between those measures of fidelity and the outcomes they were getting for the people in their study. Now, I'll spend a little bit of time on this because it changed some of the course of my thesis, really. So along the x-axis there, you'll see that's the measure of fidelity score according to IPS 15, which can score up to a total of 75. So each item you get a rating of 5 your score. And along the y-axis, you can see there the percentage of people in the cohort were getting into competitive employment. So the most reliable indicator we have for employment programs is the number of people getting to work. A number of studies also measure the time people keep their jobs as well. So you could also conduct this similar sort of analysis around job retention. But I looked on it because at the end of the day, if you haven't got someone a job, you can't help them keep it. So that was a very good measure to look at. And all this, it's obviously a measure that a program performance that is regularly collected. So you'll see there, I could ask a question, but I said it wouldn't be interactive, didn't I? So you'll see there that if you're getting under 60 on the fidelity scale, you're getting under 44% of people in your cohort into employment. So you're low, so I'd call that low fidelity, low outcome. So I'd call it a low cohort, right? So I would expect that, given the relationship in the previous work, particularly by colleagues in the United States, where they've looked at the relationship between fidelity and outcomes. And so, but what we haven't got, which I think is quite interesting, is in the top left hand, we haven't got any low-high cohorts, i.e. low fidelity, high outcomes. That's it. So it's like, well, if someone comes along to me and says to me, how do I improve my outcomes, and they're not doing very well on fidelity, then that's got to be the first thing. Yeah. But if you are doing well on fidelity, then we would expect you to be having good. If there's a strong relationship, then we'd expect actually more to be in that top right hand. But actually, I found a number of studies that actually got high fidelity but would go low outcomes. So our high-low cohorts. Now there is a relationship, and that line does show the relationship. So it's a 17% association between fidelity and outcomes. Now that is across 12 countries across the world. and a very heterogeneous sample. Yeah. So actually, and I remember Rob Kidd saying this to me, to actually have that breadth of samples and then actually still find an association was significant. So actually, Fidelity in this evidence-based practice is a very important predictor of outcomes. To actually be able to find, we actually put 6 other variables, covariates in there that we were able to extract from the studies. So things like the percentage of people with a diagnosis of psychosis, the country, this type of study, whether it was an observational or RCT study. We put those sorts of variables in, and still Fidelity came out strongly. So we were able to control for a number of other variables. So we got interested in this because we said, well, actually, if we could identify, apart from Fidelity score, what it is that differentiates those high lows from the high highs, then we've got something that we can look at to start improving performance. Yay. So I was going to do a piece of work where I looked at this, and then I added something onto IPS and saw on like training clinicians in motivational interviewing, what we're seeing in IPS research. I was going to add something on and do a nice study. Right? But when we found this, we were like, well, how do I pick what to study, and how will I find an effect, even if I pick something? What's my logic? Supervisors are going, well, if you're going to pick clinical training clinicians in motivational interviewing, what's your justification for that? And how do you know you're going to find an effect? I was like, oh, okay. So how do we search for that unexplained variance? Because there was, within our modelling. So that was the next kind of process that I went through. I decided actually, and we decided that it was worth broadening the search beyond our kind of lens of employment support or vocational rehabilitation, and actually going out there into the implementation science literature and some of the wider, broader science on psychosocial program implementation, right? So I did that. It was very scary. Right. So anyone here pulled out the implementation science literature? Yeah. There's masses, aren't there? Everyone's got a different diagram, framework, but I reviewed this systematically and drew on. I ended up, again, within my inclusion criteria, looking at 24 review studies and 4 single studies to actually look at kind of pulling out influences on program performance, according to the implementation science literature. So there you can see just a few of them. And it is really interesting, but you kind of reach saturation where, there's different terminology used. You've got that kind of internal and inner and external setting. You've got this idea of wider contextual factors. So it really gets a kind of myriad of things. And as I began to so what I did is I extracted all the kind of influences that were coming from that broader literature and started to think about that. And I was drawing it all in my study and, thinking, gosh, this is complicated. How am I going to make sense of this? Because there's, and which ones are really going to contribute to program performance? And actually, when I say to you here as practitioners, and you say, well, Helen, you need to give me some better bets than this kind of myriad of factors, really. I've got to good Fidelity, but where do I go next? And we're in a climate of limited resources, and particularly in the health and social sciences. So where do we put our effort? And I was really quite interested by the work of Joseph Dulac. There's a really good article by Dulac and Dupree in 2008, where they actually started looking and categorizing all these factors into this idea of your contextual influences, and then things that what we might call the general implementation quality. And they started saying that actually there's a strong direct link between program implementation quality and program performance, and program implementation quality is broader than just program fidelity. Now you're all going, I could have told you that, Helen, before you started. But I think I've been very fixed in our work, because also it was the thing that was coming out and showing us the outcomes. But if we're going to genuinely improve programs, we needed to search more broadly. So I was sort of saying, well, actually, we've got these contextual influences like training and on-site implementation support, technical assistance, policy and funding environments, the organizations that are implementing the intervention, our staffing factors, all the things that, we know influence. It's very hard to isolate that influence. And they're being mediated through the quality by which we implement the service. And that is wider than program fidelity to deliver better outcomes. So I felt much happier once I started to frame it and categorize all the influences into those two categories and get all those little blue text boxes into this kind of logic. So what I did is we developed a generic implementation framework with all those factors but all organized, and then re-examined the literature and drew on the empirical literature from vocational rehabilitation and psychiatry to go, well, which of the influences seem to have the empirical evidence to be the most directly related to program performance for sport employment programs, right? So let's systematically prioritize those influences and come up with a new implementation framework for voc rehab. So that's what I did. I came up with another diagram, but this specifically for our field. And this is for you, where you go, okay, Helen, where do I focus next? We've got 80% fidelity, where do we focus next? And I will simplify this in a minute, but just to say to you that it's the middle bit that you start to get more interested in, yeah? So these are broadening out our definition of implementation quality, or quality of program delivery, more broadly than measuring adherence to a model. Yeah. So this might be something like program intensity. So often with fidelity scales, we've got some measure of program intensity, but not necessarily written into the fidelity scale. I'll give you an example of that. In a trial of individual placement support in the United States, in the UK, they had a good score on fidelity, but actually found that the contact between the employment advisor and the person looking for work was actually not that much. Even though it was a good fidelity service, the person wasn't getting that much of it, so i.e. program intensity or program dosage. So those aren't often measured. So if we broaden that out, those are some of the things. If we look at a particular, another example in the United States, there was almost 4 times more contact in that high fidelity service than there was in that UK one. So that was very clearly, it could be a reason why that was explaining the difference in the high performance of that in the US study, potentially. So also what I did is, if you look at some of the wider, my generic framework, something like technical assistance and program evaluation, they were more on the outside than some of those other models. And I pulled them in closer because I felt that the empirical, what we found was there was much more empirical evidence supporting their direct relationship with program outcomes in the context of vocational rehabilitation programs. So we were finding empirical evidence that showed a direct association to outcomes. So they were pulled into the inner circle, when on other models they were outside. So this is what you can see. And if you're thinking about it for Housing First, you might look at your literature and look at generic implementation framework and pull into the inner circle what has the strongest evidence base for a direct influence on program performance, and also what can be more easily operationalised, i.e. we can measure it. Because if we can't measure it, how are we going to understand its effect on program performance? So that's why we ended up with 9 dimensions of implementation quality in addition to program fidelity, and then you've got that peripheral stuff. Doesn't mean it's not important, but our ability to show its influence on outcomes is going to be limited. It's likely to have mostly an indirect effect through some of those. And if you look at one of the most recent meta-analyses on IPS, randomized control trials, where we look at the influence of policy and unemployment rates, we're not finding an influence. We're not finding an association across the effectiveness of our RCTs. So that makes sense in terms of its wider context. Doesn't mean it's not important. And if you're a policymaker listening and you've joined in, it is actually, you still can open up the road for a good implementation, but it's unlikely in your quest for improving your performance that that's going to make an enormous amount of difference potentially. This is the inner circle. So employment specialist expertise brought that in. Why? Because in employment services, it's that one-to-one relationship that's actually crucial. So actually in this type of intervention, that person is going to have a crucial role on outcomes. No pressure. You employment specialists in the room. So let's move in a bit more closely, just keeping an eye on time. So that's where we get, so you're now coming to me and saying, well, we've got 80%, got 100 out of 125 on our fidelity scale. We're really doing well. Where shall we focus next? And then what I'm looking at doing now, another plug, please join me, is trying to develop scales where we can measure effectively what do we mean by quality technical assistance? What do we mean by program evaluation and feedback? What do we mean by employment specialist expertise? Because if we can start to develop and test and validate scales that measure those effectively, then we can see and do the same sort of systematic review and meta-analysis and understand and RCTs to see what effect they're having on program performance when we introduce them into an IPS program. And what we are seeing a lot at the moment in the individual placement support literature is a lot of add-ons or a lot of adaptations. It doesn't quite work. It doesn't quite work, and it's hard to implement. And so we'll just change that bit. Well, actually, let's get to good fidelity and then look at changing. But actually, why don't we implement better? How can we, so removal of non-evidence-based practices. Sometimes, we got referral pathways into services that mean that slow down the process of somebody getting to an employment service, that mean that somebody's doing a lot of training before they're helped to look for a work. Perhaps it's about identifying some of those things and removing them from the program. Yeah. So again, in some cases, one of the Northern European studies, the welfare benefit system, so in our outside influence, said people before they go to the individual placement support program have to do 6 months of training. That's what the welfare system said, and that 6 months of pre-training before you go and look for work is a non-evidence-based practice, been proven to reduce your chances of getting back to work. So you can see it's actually it's not that you need to change the welfare system, but actually it's that practice that needs identifying, removing, and then that kind of advocacy with the welfare agency. So I'll give you a couple of examples before finishing and taking questions. The next few parts of my thesis, and it's really hard to condense your thesis into half an hour, isn't it? But I'm trying. But the last 3 chapters, I really looked hard at some of those other concepts. And in fact, I'm just going to go back to that diagram. I want to just say participant responsiveness. I really thought a lot about that concept, and there's a whole chapter on participant responsiveness. I defined it in the context of what the program can do to encourage engagement and some people to stay in the program, rather than and parts of that is a characteristics of individuals, but it's very easy to assume there's a group of people who will benefit from this and a group of people who won't, and that's not what I looked at when I looked at participant responsiveness. I said, what are the things that are in our locus of control as providers? What are the things that we can do to ensure we have an engaging, diverse, inclusive program that keeps people in it and encourages people to job search outside of meetings, encourages people to come again? And what are the types of things we can do to improve the responsiveness of the people, rather than it be something about some intrinsic individual characteristic of whether someone's motivated or not. And you'll know from your own experiences that people come along and they'll say, I'm interested in work, and the next week they'll say I'm not interested, or they won't turn up, or and that's because somebody's got nervous about looking for work, or who would employ me? I've been out of work for several years. I'm not sure how to talk about the addiction or the mental health issue that I've had. So you're not saying, the person's actually not saying I'm not interested. They're saying I'm nervous about putting myself forward. And so actually a program that really works with that and actually brings the responsiveness out of somebody, if you like, is likely to be more effective. So when I looked at how we conceptualize that, that's how I did a lot of work on that, and I'm going to be publishing some of that work. So I just wanted to flag that because it sounds a bit labeling, a bit uncomfortable with that. So let's look at this example of operationalising employment specialist expertise, because I think that in our field, that's the next emerging area. We've got a lot of empirical evidence that's showing the types of skills and knowledge and attributes of the people in the roles. And what I was able to do is synthesise the empirical literature and come up with some behavioural indicators that show what differentiates some of the higher performing employment specialists to lower performing. So I think really, if you've got a good Fidelity service, you've probably got basic level of competency across all your staff. So what's the extra bit? What's the bit that takes somebody into expertise, not just competency? So really, and this is from the available literature, we were able to see that really establishes a good working alliance with the people on their caseload, secures jobs that align with the person's preferences and desires, develops the person's own job search skills, provides employment assistance to participants, employees in the workplace, and how the person does that. There's been more and more emerging literature on what that looks like when it's done really effectively. Really develops a network of employers. So a piece of work by Jeff Waghorn and others, really looking at the fact that high-performing employment specialists have this great network, a much wider network of employers than those who were performing not as well. You're really good at relationship building, puts in that extra effort. So rather than go, yeah, you've got this barrier, I can't deal with that, actually goes, well, let's deal with that. Let's think about that. How can we help? How can we work with you? So that's, again, the empirical literature is showing those people who go that extra mile is really important. And actually that whole idea of actually being able to manage a caseload of people and your admin work and all the rest of it, how do you keep 20 to 25 people's names and thinking about where people are on their job search, looking for jobs, who you're working with, that it requires a lot of organisational skill and management. So those are the kind of indicators, and if we can build a scale to measure those behavioural indicators, then you can get a score on that and think about how you improve your performance in relation to those. So that's what I'm working on. Plug, really interesting work, come and help me. And then again, something like technical assistance, which is also relevant to some of the Housing First stuff, so we could work together on that. What is good technical assistance? So I started off with an operational specification from the literature, what is defining what technical assistance is, and then thinking about what the aspects of that which we can measure would be. So the nature of it, the type of it. You know, it's not just someone coming along and saying, I think you need this. It's someone coming along and saying, what do you need? What's the problem? What are we trying to do? How much support do you need? Is it right? Am I working with the right people? So there are ways we can measure quality of technical assistance. And I think we're not doing that at the moment. So we've got emerging work from ourselves here and also in the States, which is showing much higher fidelity and much stronger outcomes more quickly when you provide on-site technical assistance to implement an evidence-based practice. Well, let's measure whether we've got good technical assistance and what that looks like. So just finishing off really from my work, and I hope that you've taken that away from my talk today, that in this particular instance, fidelity to evidence-based practice is important for programme performance, but it's not sufficient. Broadening, having that light bulb moment that I did where we broaden out our definition of what implementation good quality looks like, and thinking about in your field, what are those things that would mean it's good quality delivery, even to the extent of something like, how does your offices feel when someone walks into them? You know, you can have the best pizza recipe, but if the person who delivers it is not friendly and welcoming when they come, or it's cold, or the box is broken, then it doesn't matter if you've got the best recipe in the world. It's not going to be what you want. You're going to complain. So, you know, let's think about, you know, how all the things that are influencing someone's experience and why people stay in the program and how we get good outcomes. And I've shown you very quickly, but again, you can read the paper, how I went through a method of systematically searching for other variables and thinking and prioritizing those variables so that we can really focus in on what's effective. And if we can develop those scales, then actually we can really help program leaders, administrators, yourselves in the program, and policymakers to actually further improve our performance of employment services. Actually, let's face it, that what's most important about that is we've got to improve this terrible inequity that we have, is that people in contact with specialist mental health and addiction services have an employment rate of less than 20%. And at least 90% of people really want to work. So really crucial area of research. Thank you.
Thank you very much, Helen. It's really great to hear the culmination of all this work that I've kind of heard little bits about. And I think really great to think about how applicable it is to a lot of the work we do in public health, in terms of thinking about how we take evidence and turn it into practice, but also how it matters not just what we do, but how we do it, and the importance of relationships as well. So yeah, fantastic to hear about that work. Questions? Questions from anyone?
Hi, Alan.
Hi.
Thanks. It's really interesting for us, as you said.
Yeah.
I am really curious, coming from Tupole back in the day, we talked a lot about the importance of the quality of engagement as a predictor of outcomes, and I wonder if that was addressed in your research. I know it's because I don't see anything. This is a really huge.
The quality of engagement.
Yes, you know, the Barry Duncan, Scott D. Miller kind of research.
Yeah. So that's all on the conceptualization and looking at what we mean by participant responsiveness. And the reason why I've spent a long time on that is that in vocational rehabilitation, we spent a lot of time collapsing that into participant motivation or client motivation. So this person is motivated and this person is not. And if we can work out whether you're motivated or not, if you're motivated, you're going to have access, and if you don't, you can't. And I spent a long time thinking about some of that wider engagement literature and thinking about how we might be able to turn that a little bit on its head and think about how we are as a program and how we are more engaging as a program to who and how often and when and how we're doing that. So in that chapter, I did look at that, and I wanted to try and write that up but I was trying to be quite sensitive because I think it's a fraught area because as soon as you start writing something about that, it's very easy to jump on it and go, Helen has said this, and therefore this group of people are going to respond to this program and this group of people aren't, rather than seeing motivation as something that is a very dynamic, changing experience for somebody that changes over time. According to also, like if you come in and you're not sure about if you want, and I come in and go, you could, and how you engage, and suddenly you've gone from, okay, you think I could. And that's what we see. And some of the qualitative work, particularly in individual placement support, really delves into some of those people's experiences and shows it's that trust, it's that hope, connectedness, that hopefulness that a worker shows to somebody. It's Neville. Not Nigel, it's not Nigel. But I was, starting off.
No, thank you very much for a lovely presentation, actually, and a really cool PhD. There's excellent work in there. That's really cool. I'm interested in the kind of, how do we go, so this is all defined on a narrow outcome of you're employed, you're not employed, this is it. How do we go and see, is this helping the person's well-being? Is this better for them? Is it long-term employment, or is it secure, precarious, low morale employment?
Yeah.
How do we look at those kind of, does IPS give us better, and does better IPS give us better?
You're better than not working at all. And that quality of jobs that people are going to. And I think job retention is an important indicator, a proxy indicator for that in terms of people staying. And in fact, but also AUT are doing some research at the moment, a lit review, looking at what helps people who experience mental health and addiction issues to go into work. And they've done a systematic review and also a review of qualitative studies, and they were looking at some of the narratives that were coming up, not necessarily from IPS, but actually where people are hanging in jobs that aren't actually very, very good because they just feel that they need to keep it and they're working really hard at that. So I think we do need to think about what that quality is. But if you look at the type of jobs that people are getting through an individual placement support program, and I think that shows you the importance of a quality employment program, is that you're not supporting somebody into any job and you're not supporting someone into a job they cannot do. So people used to say, Helen, your job's really hard, when I was an employment worker. And I'd say, it's not hard. You find out what somebody wants to do and you help them get that job, and you make sure they can do that job, whether it's with support or not, and whether it's with accommodations. So that is what you're talking about in terms of the quality of the program. I don't think that you're not, and I think we also need to think about that in terms of contracting, to make sure we're not contracting for outcomes that mean you're having to push people into jobs. And this area is fraught with the idea of cherry picking. So you can change the outcomes you get by changing the groups of people that you work with potentially. So yeah, I'm not sure that, but we do need to think about, we could build some wellbeing indicators into that, but I think job retention would be a good indicator, and satisfaction with your job. Oh. I think it's just my mum online, actually.
First of all, great presentation, and also, second of all, I understand the value of this type of work is largely about shining lights in places that haven't been looked at before from research perspective. So I understand the value of challenging the status quo with how people thought about this sort of thing before. That having been said, can you expand a little bit more on how you identified the variables that you've highlighted as important, and also, if you can, what strategies, if any, you used to identify how sure you can be that these are the variables that are important around certainty of your findings?
So I think the reality,
out of genuine interest, not out of
no, that's fine. That's fine. This sounds a bit like my oral exam. Yeah, that's all right. So the reality is there are limitations there, which is it's just a roadmap. at the moment. It's a roadmap. It's the best. In order to get to these other 8, I widely reviewed the empirical literature from psychiatry and employment services, employment support services, and gave them a rating according to how many studies actually proved an association between that concept as it was defined in that study and the program performance. Now, there isn't a lot of literature. So, however, actually, having said that, employment specialist expertise, there is actually an emerging growth of literature in that area, in our particular field. So actually, I was able to cluster that and be much more confident. It looks like that's that would be where I would go next in terms of improving. But until I've only partially operationalised it. So what I was just describing, and as Rob and Jeff said with the PhD, you have to stop writing sometime, Helen, and you have to hand it in. And that's why there is a programme of work here which says I partially operationalised what I could do. We need to further operationalise them and put them and develop and test scales. So that we feel that we can develop and understand employment specialist expertise. And we could do that in conjunction with colleagues in other parts of the social and health sciences. It doesn't have to be just in this, so that we've got some valid scales to measure that. And also their ability to be operationalized. So for example, with participant responsiveness, there's a large scale study from Canada and the Netherlands, which is showing that that showed of all the variables that help people get work, it was the person's how many active job search behaviours the person engaged in. So if you're thinking about that from a support perspective, then your ability to enable someone to engage in more job, and how you coach somebody in doing job search, how you shadow alongside with somebody, then those are the sorts of things that will go. So does that help answer you? But it's a, there you go.
I just wonder whether your research looked at the attitudes of employers who are employing these people, because that can often be a barrier to getting them into employment. Yeah.
So I'm going to go back to that picture. And if we think about employment specialist expertise there, and then we think about the attitudes and beliefs of line managers and work colleagues, I've got there. But actually a really good employment support service should be, and those employment expertise should be interfacing with those employers and looking at those attitudes and practices. So yes, on a macro level, that's at a public health intervention, we can be improving all that external circle, improving it for everyone. But at an individual level, then it's going to be the quality of that expertise of the service that you come in contact with and that worker, and their ability to, like if I went to an employer, and I did, you went to a lot and you go to a lot, and they have a bad attitude, I don't waste time changing that attitude because I've got this person who's trying to find a job, so I move on to the next employer. I might flag, and there might be a health promotion program that can get into that local area and think about that. But as an individual, I would be doing the person I'm working with a disservice if I spent a lot of time then trying to change their attitude. Doesn't mean it's not important. It means it won't help. I wouldn't match somebody into a role. I wouldn't support somebody in a role where I thought there would be a discriminating environment. It wasn't good. So yes, it's important. And yes, we still need to do it on a population level. And you do it in an individual level when you're supporting somebody. Yeah, and others from Sweden have done some of the research on that, which is actually really interesting. Yeah.
I was going to say, because I have a physical disability with mental health stuff, I've actually had to do all of my own education with employers. And I often find that support people in places like Emerge, they don't actually understand it. And they're not very well equipped for educating people. Yeah.
And I guess what I'm saying is that is a crucial component of an excellent employment advisor, because that's what you're looking for. You're saying, actually, I'll deal with the other stuff, but can you come in with me and help with some of this stuff? And we did a lot of work, and there's not a strong evidence base that just general awareness stuff is helpful, actually going in and thinking about what it is for that person. I also think it's really important that we have public awareness campaigns here that move us beyond move us into the workplace. So if we think about Like Minds, there's a lot of public awareness that could be doing that was saying, actually, and working is really good. and this is what our good workplace could look like. And we could be doing a lot more around that. And also we could be doing, if we think about some of the mindful employer stuff, you could actually as an employer get a tick to show that you're a good employer. And there's a lot more and more in New Zealand. And then you'd go, actually, I'm not going to get a job with you, I'm going to get a job with you.
Hello. Thank you so much for the presentation. It was great. And it's really good to gain a deeper insight into the wider piece of work that you've been doing. I actually have two related questions, I guess. One of my questions is about it's more IPS focused, I guess, around the in-work support aspect, with the related to the employment specialist expertise part of it. And I'm just wondering, with, I guess, the way the contractual agreements and all of that kind of stuff is kind of set up with, you know, various different contracts with the different employment support services around. What does that mean with the in-work support, where the first few months might be fine for the person and then they really start struggling after that? Yeah. How is that captured within your research?
So again, and so this is hypothesizing that it's the employment specialist expertise that we'll be able to measure.
Yeah.
And one of those criteria is the ability to support somebody in the workplace. However, if your contract doesn't allow you to support somebody on an ongoing basis, then that's going to affect your, but what we'll be able to measure is, you know, and if we have that scale for employment specialist expertise and it comes out 0 on long-term employment, then we'll go, well, why is that happening? Oh, and you do that intuitively to a degree. You know it's happening because your contract says you can't support somebody after 2 months in work. But actually it gives us a reliable measure for research purposes to start seeing that as you change that, then does it improve the performance of your program? So in-work support is predominantly captured in employment specialist expertise, and also probably in participant responsiveness as well, offering that. And probably in program intensity a bit, but so these aren't mutually exclusive, some of these, and that's why you need to develop scales, because so that you can actually say, well, we're measuring that in this bit, and then you can. Is anyone here into psychometric scale development? Because I really need to meet somebody who's. Oh, great! Yeah. Oh, thank you. Will Taylor. Yeah, because it's a skill in its own right, isn't it? So you know, and it's really, you know, it's a great, really interesting. And when we get, you know, we're so lucky with the IPS Fidelity scale. I don't know how much you've done around the housing first one, you know, but it's you know, we have a reliable and valid scale. So I hope also for those of you working in the field today that you've gone away and thought, actually, these are the things that I could improve on next. And when I did this exercise with clinicians and IPS practitioners in the UK, I said to them, I didn't show them this. I said, right, because they'd listened to me for longer than you have, and done that whole scatterplot thing, and you know, and so I said, well, will you go away and think what after Fidelity are the things that you'd focus on next? And they actually did an exercise where they came up, you know, from their own experience with a kind of version of this. And then I said, you know, after 2 years, I also came up with that, whereas you've come up with it in 10 minutes. But there is a rationale, there's a clear evidence base behind why some stuff is in there. But I think it has practical utility, as far as I can see from people.
We've run out of time, unfortunately. So thank you very much, Helen, for sharing this, and we will thank you.